All right, thanks very much, Dave. Just as way of introduction and just to really say thank you very much for the opportunity to present and to talk and to socialize some of our findings from various reports, and really to introduce the next couple of days and the work that we will be delivering to yourselves as interested stakeholders within mobile health. So thanks very much. Can I just see, by a show of hands, and more to see if you're awake than anything else, I think at this stage, getting the graveyard shift for 2:45, who, just by means of raising your hands, does everyone understand or know who the GSM Association is? You just raise your hands if a yes. Is it mostly GSM employees at the back? All right, so let me explain who the GSMA is. GSM represents, or the GSM Association is really the global trade organization for all GSM network operators operating on a global level. We have some 800 operator groups in our membership. We have roughly 250 associate members, being our handset manufacturers, the tech developers, the software communities, and so on and so forth. And you may be asking what the connection with health is to the GSM Association for a trade organization. Well, let me start off by saying that the GSM Association and mobile network operators inadvertently are incredibly interested in a number of different verticals that can be leveraged and delivered through the ubiquity of mobile technology. We have a number of those verticals within the GSM Association, being mobile agriculture, mobile money, mobile education, the empowerment of women, and mobile health being the latest addition to that. So over the next few days, we hope to really unravel what we're doing within mobile healthcare, and you'll be able to see a number of reports, a number of discussion groups, a number of opportunities to become involved in our work. And I highly encourage you to go to either the Mobile Health Summit website or mobilehealthlive.org to find out more. So I included this first slide and just to really paint a picture of current state of mobile health. And I think after a number of discussions and presentations this morning, I don't think that I really need to discuss this at length, because I think we realize that as Dave has said, as Dr. Jürgen Pillay said this morning, representing government, as Robin mentioned in what seems an extensive research that they've just carried out, is that we're hearing a number of different themes being discussed at the moment, and namely the scalability and sustainability of mobile health projects. Looking at behavioral economics or education using mobile, and using HIV/AIDS as an example of that, just a very quick literature review revealed more than 350 peer-reviewed published studies that document the efficacy of mobile to influence behavior of population groups with respect to STDs, HIV, and AIDS. There are more than 40,000 resources covering topics related to HIV, AIDS, and mobile health. There are 258 authoritative websites documenting innovative approaches to using mobile to prevent disease. And there are 0 scientific studies documenting the efficacy of mobile health interventions operating at a national scale. So we ask why the GSMA is interested in mobile health. Well, it's because we want to increase that last target condition to create sustainable business models for the mobile community that can increase the reach, reduce the cost, and improve patient outcomes.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
Go!
All right, so great example there of just being able to see something differently. And video is always great. It's the greatest representation of what we're trying to say. And really within the GSMA, we believe that we have the capacity, we have the reach with 800 members being mobile network operators to deliver mobile health in a way that will be transformational, reformational, and literally change the face of healthcare as we know it. Some of the work that we're doing, and this was just it's a very, very brief introduction with the hope that over the next few days you'll join us in those discussions and workshops, particularly on Thursday. We have a series of workshops where we'll actually detail more of the findings as well as the methodology of our work. We are releasing, or we have released, a report on the mobile health opportunities within South Africa, and that's why it was very strategic to host this conference in South Africa. You'll be able to pick up an executive summary on your way out at the back, and really the full report will be available on mobilehealthlive.org. So please go and register, tell us about the work that you're doing, download the report, socialize the findings, and really we welcome the collaborative process that follows from that. So really, just as a means of introduction to that, the Decision Support Toolkit really aims to identify the mobile opportunities at a country level across the world for the mobile community. These are some of the findings, and I'll just present two figures for you on the report for South Africa. So we look at a very country, a macroeconomic level, and look at an analysis of the health infrastructure. We look at the mobile infrastructure. We look at health financing. We look at the mobile community, the mobile health community. We look at government policy and regulations, white papers. So it's really an exhaustive analysis of quantitative and qualitative research that goes into the report writing. And here you can see just some preliminary findings of what the South African healthcare system looks like. The aim of that, as I said, is really to try and identify the opportunity areas for the mobile community. And here you can see the presentation of those opportunities just in a very simple figure, with the target market being represented on the vertical axis being our payers, producers, providers, and consumers, and then on the horizontal axis you can see the various mobile offerings that are available, and we will then try and quantify a significant, a moderate, or a minor opportunity. And the reason we do that is because we go back to the mobile operators, our members, all 800 of our members, and we say, guys, there are significant opportunities for mobile stakeholders within South Africa. This is why we think they're significant opportunities. They're significant opportunities to scale and to create sustainable business models for mobile health. And we will then work together with those mobile operators and the wider mobile community to commercialize and create that sustainable business model. So taking those opportunities, what we then do is, if we've for instance decided that the consumer group is a significant opportunity, we will unravel that and we'll take it into what we call a market entry toolkit, which is really saying, what are the considerations that we need to address within the next 6 to 12 months that will enable us to deliver that or meet that mobile opportunity. And there are a number of different chapters that we really address within this. We tackle a plethora of things, and here are just a few of them. We look at the products and services portfolio, so really building a database of what types of products the mobile operators or mobile community can use to actually meet that opportunity area. We look at health architecture, principally around standards and interoperability, which are huge words that we need to consider for scalability and sustainability. We'll look at technical architectures. We'll look at enterprise architectures. We then look at reimbursement models for mobile health. We work very closely with the mobile community to develop those in innovative ways. We will also get involved in policy and regulation. What will happen here on Thursday at the Mobile Health Summit, or as an addendum to the Mobile Health Summit, is that we convene a leadership forum, which really brings together, I think we have 14 countries represented at a ministerial level: Ministry of Communications, Ministry of Health, Ministry of Science and Technology. And that roundtable discussion will focus on policy and regulation and how can we really leverage that ubiquity of mobile and the position of mobile health to create the sustainability, to create the partnerships, to create the interoperability, and to set the foundations for those sustainable products. Sustainable business and go-to-market models, really self-explanatory, but really in that we're trying to understand how mobile community can best position mobile services. Is it as a value-added service? Is it within an operator foundation? Is it as an NGO? Is it a standalone business? Or is it within the broader context of convergence of mobile money, mobile retail, mobile health, and so on and so forth? And then monitoring and evaluation, which really ties everything together. So we really believe that we have to start talking, if we're going to engage with the health community and create wider adoption amongst consumers and healthcare professionals, we want to understand that we're talking about a healthcare currency. At the moment, we're talking about a market share and revenue potential for mobile stakeholders. But within healthcare, what we need to start considering is what is the ultimate impact, what is the total impact on healthcare outcomes, and what is the total impact on cost? How can we use our products and services to reduce cost? And this diagram really speaks to impact and cost and to what the broader initiative or broader aim is within the GSMA Mobile Health Program. How can we extend the reach? How can we reduce the cost? And how can we increase outcomes? And here you'll see, in amongst the four quadrants, in your top right quadrant, it's a relatively no-brainer. If we can reduce the cost, or sorry, bottom right quadrant, if we can reduce the cost, but at the same time ensure a greater impact, it's a no-brainer for everyone to reimburse you for your mobile health service. But the other three quadrants really talk to something that we need to create a significant change to impact and cost to be able to motivate for the reimbursement of our products and services. And I hope and invite you over the next couple of days and weeks and months to really come and participate in some of the conversations that we're starting on a global basis, whether it be on mobilehealthlive.org, whether it be in the corridors of the next few days, whether it be in the number of working groups and conversations that we will host and advocate for around the world. So by all means, come and ask questions, come and pick our brains in terms of the methodology, and please read the report that's just been released, and we will be releasing more on further countries shortly. So thank you very much.